My name is Arthur Kaufman. I'm the Chair of Family and Community Medicine and the Vice President for Community Health at the University of New Mexico. And the relationship between the university and First Choice goes back many, many years, and it's grown over the years. And the thing that's most important about this relationship is that when we look for models of training which would attract young students and residents to primary care, First Choice is really one of the top locations for attracting that kind of health workforce for the future. And why is that? And the reason is because where they train and where they learn is actually in the community. When you train at the university, the priorities are often inpatient, it's very subspecialized, it's not the richness of the community. When you see patients at a First Choice site, the community is very involved. You're living in the neighborhood, you're working in the neighborhood. Now, First Choice was one of the most important partners with the university because we developed together the concept of a health commons. What that means is we're not just going to have a patient come in and just see a doctor and go home. The kinds of needs, especially in an indigent community, the kinds of needs that people have when they bring their medical problems often are social and behavioral. Issues of poverty, housing, access to jobs. And you have to have, if you're going to actually improve health, access to all of the resources necessary for that kind of complex need in a community. So a health commons is like a one-stop shopping. You have dental, you have medical, you have behavioral health, you have public health, you have community outreach, all together in one site. And that's what the First Choice facility is right here in the South Valley. And other First Choice sites, in partnership with the university, are being set up in exactly the same way. To expand this relationship, we are actually now appointing First Choice doctors and university doctors to be parts of each other's systems. So we're really starting to integrate. We have our own separate administrative structures, but increasingly we're linking them. So I have the pleasure of being on the First Choice board, and the medical director of First Choice is on our faculty. So that's an example of how we're working together.